everyone, I'm Tia. The paper I chose is titled Early Parent-Child Relationships and Risk of Mood Disorder in a Canadian Sample of Offspring of a Parent with Bipolar Disorder. Findings from a 16-year prospective cohort study by Duchette, Levy, Flowerdew, Horks, Gorf, Ellenberg, and Duffy. The authors examine any associations between parent-child relationships and risk factors for mood disorders in the offspring. Now, what is a mood disorder? A mood disorder is characterized by either an abnormal elevation or abnormal lowering of a person's mood. This paper highlights bipolar disorder, which alternates times of depression and mania. It assesses how a parental diagnosis of bipolar disorder impacts children. I chose the study in particular for the assignment because it was conducted in Canada, mainly Ottawa and Halifax, and its relation to course content by providing a link to risk factors that increase the likelihood of mood disorders in children. There was a generous sample size of 233 offspring. However, some were siblings, leading to slightly less diversity than one would first think. A majority of the participants were from high socioeconomic status, which makes it difficult to generalize the findings to the entire population, as those of low socioeconomic status often have less access to supports and resources for managing bipolar disorder and also have more variables affecting parenting style and family dynamics. The study was conducted with an initial psych assessment of the parents, while children completed an initial blind clinical review. Afterwards, there was annual follow-ups with clinical and research psychiatrists and self-reporting measures by the children for temperament and early diversity. Bipolar disorder is already known to have a strong heritability of about 85%, but the authors want to know more about the other contributing factors. They found that childhood trauma increases the risk of bipolar disorder, impacts the clinical outcomes of a mood disorder, leads to earlier onset, increases the likelihood of suicidal behavior, and often results in a more chronic condition. Living with the psychologically ill comes with numerous environmental stresses. The longer the exposure to these stressors and the younger the child was when exposed, only further increases the risk of a mood disorder. High-risk offspring that receive a bipolar diagnosis themselves reported greater rejection and negativity from their maternal parent compared to all other unaffected offspring. The findings are that the offspring that developed a mood disorder had significantly greater exposure to parental bipolar disorder and higher perceived neglect and antipathy from the maternal parent, whether or not she was the one with bipolar disorder. Offspring with greater exposure to parental bipolar disorder also had greater emotionality. A recurring theme from the findings states that perceived neglect from the maternal parent also led to higher substance use issues and greater anxiety. It was this finding of perceived maternal neglect and antipathy having the greatest impact for numerous diagnoses that interests me the most. I'd love to see further research done on how healthy and unhealthy maternal-child relationships correlate with later psychological disorders in the child. Thanks for listening, and I'm looking forward to the discussion in the comments. Have a great day.